All right, it is Heart Health Month, so today in Healthy Living, we're going to talk about a common but also very serious cardiovascular condition called deep vein thrombosis. This medical condition is sometimes referred to as DVT, and some of you may not be familiar with it, so I'm going to ask Dr. Stan Thornton from Cardiology Associates to explain exactly what DVT is, please.
Well, thank you. March is National DVT Awareness Month, so we're getting an early start. A DVT is when a blood clot forms in the large veins, typically in the legs or pelvis. Unfortunately, DVT is a very common medical condition. It affects about 2 million people in the United States each year. The most feared complication of a DVT is actually a pulmonary embolism, or PE. This occurs when the blood clot detaches from its site of formation and travels to the lungs, where it can cause respiratory problems. About 400,000 people will have a pulmonary embolism this year, and half of those cases will be fatal.
Goodness. And there are a lot of factors that can increase someone's chances of developing deep vein thrombosis.
There are. The people at most risk are hospitalized patients who are on prolonged bed rest. This is especially true if they're going through orthopedic procedures such as hip or knee replacement. It's estimated that about 60% of people going through hip replacement surgery will have a DVT if something is not done to prevent it.
Okay, and I read that this is a condition that occurs without any noticeable symptoms in about 50% of cases. Is that right?
That is true. And the people that do have symptoms, they're rather nonspecific. They may have tenderness, pain, swelling, warmth at the site of the clot, but these are not specific symptoms, and lots of other diseases and injuries can cause these same symptoms. So it's really important that if you have these symptoms, you seek medical attention.
Now, how does a doctor determine if a patient does, in fact, have deep vein thrombosis?
DVT is usually diagnosed with a simple non-invasive ultrasound. This can be done in most physicians' offices or at the hospital. If we suspect a pulmonary embolism, a lot of times we'll order a CT scan that will provide the diagnosis.
Okay, so what is the goal of finding the DVT, and what is the goal of treating it?
Well, the most important thing is prevention. Prevention is always the better option, but the treatment is important because of the pulmonary embolism. That's the most feared consequence, and about 200,000 people died from pulmonary embolism last year, more than breast cancer and AIDS combined.
Goodness. And preventing is much easier than treating, right?
Very much so. There are some simple strategies that we use, most often low doses of blood thinners on a daily basis. For those people that can't tolerate blood thinners, we have some simple non-invasive mechanical devices such as inflation devices on the lower legs that keeps the blood from becoming stagnant.
Okay, so this is something that, you know, if you have any kind of risk factors that you want to talk to a cardiologist about. So they can, of course, come and see you. Absolutely.
And there's also a lot of good information on the internet. One particular website is preventdvt.org.
Okay, so again, all of that information, I know it's a lot to take in, but you'll find more information on our website as well as links. Studio 10 tab on fox10tv.com. Just look for Healthy Living. Thank you for coming in.
Thank you very much for having me.